Hello, my name is Naomi, and today I'm going to talk to you about my perspective and reflection of the reading of this week. We're going to start with the first question. What are the main points of these readings? These readings focus on the importance of providing culturally incompetent patient-centered healthcare to meet the needs of the migrants and population. In the article by Tucker in 2015, introduced the concept of the patient-centered culturally sensitive healthcare, or PCCHEC, that arguing that when healthcare delivery aligns with patient, the cultural values and beliefs, it can lead to improve patient satisfaction, better communication, and ultimately better health outcomes. Their model emphasizes that care must be both responsive to cultural difference and focuses on the patient's unique needs. In the article of Thomas 2016 expands all these ideas by addressing cultural incompetence and specifically in the context of the migrants' healthcare. He explained that cultural competence is not merely about the language proficiency, but encompasses a deep understanding of the social, cultural, and structural factors that influence migrants' health. And this reading underscores that healthcare providers must engage in continuous self-reflection and adapt their practices to overcome the barriers immigrants face. This is such discrimination and miscommunication in order to provide equality in care. And the last one is the report of teaching culture and competence in healthcare in 2002 that offers comprehensive review of the current concept, policies, and training practices that is highlighting the teaching of the culture and compete in essential for reducing health disparities and improving service delivery. The report advocates for a standardized approach to training that goes beyond the technical knowledge, incorporating both interpersonal skills and awareness of the broader institutional policing framework that affect the cultural diversity in patient populations. Continuing with the second question, was anything unclear or confusing for you and why? This, despite my previous familiarity with migration health topics, I still found some aspects that are challenging me, specifically in one area that's confusing me, and is the differentiation between terms like cultural sensitive and cultural incompetence and patient-centered care. This one, although the readings provide definition, the overlap between these concepts sometimes make me like a little bit difficult to understand where one of ends and the other begins or started. And this ambiguity is important because it affects how healthcare professionals are trained and how policies are implemented in practice. Another point that I think I don't have to understand a lot is from the perspective was how the operationalizes this concept with healthcare settings. While theoretical model represents the translating them into measurable outcomes of training curriculum remains of shown. Like for example, in the Tucker article, provide a model linking cultural sensitive to improve adherence, but determine which specific behaviors or policies change lead to measurable improvements in patient outcomes. And this requires further classification and research. And furthermore, the integration of these concepts across the difference of the different healthcare organization and cultural contexts was sometimes hard to grasp, and this really suggests that success of culturally competent care depends not only on the individual provided skills, but also on an organizational support and policies. And this multi-level approach adds complexity, making it clear how one might prioritize efforts when resources are limited or when the institutional change is so slow. Continue with the third question. What was new to you in this change? How you think about or perceive the things? Although I have a previous knowledge of the migration health topics, this really depend my understanding significantly because I was particularly struck by the detail of the discussion and Tucker article on how patient-centered cultural sensitive care can directly impact the treatment and the adherence of the overall healthcare and outcomes. And this model shifts my perspective and by demonstrating that improving healthcare for migrants is not just about language translate, but requires a comprehensive approach that encompasses the provider attitudes, communication styles, and even the physical environments of care facilities. In the article of Thomas 2016, this provides a further insight by the emphasize that cultural competence is like a lifelong process that ensures that healthcare providers must continuously adapt and learn to better serve culturally diverse population, and this resonated especially with me. It made me reflect on my own experience in clinical when the setting I realized that even a small gestures and such a taking the time to understand the patient cultural background and how this can make a significant difference in willing to trust in private and career outcomes. In the last one report, in the report of the teaching culture and competence, this introduced me the idea to the cultural competence should be an integral part of professional training and not treated as an isolated topic. This is highlight the importance of standards in the curricula and ongoing on professional development. And this relationship has influenced how I view my professional growth in healthcare, like the prepping me to value not only technical skills but also that have the critical interpersonal and cultural skills to necessary to deliver an inequitable care. I think, for example, learn another language more than English. I think this is a better option to have to give it a better services in my own profession. In the first question, was there anything you would like to explore further or learn more about and why? I would like to explore further the practical implementation of culturally competent training in the healthcare settings. Although the reading success provided theoretical frameworks and models, I'm interested in understanding how these are translated into the practice like the day to day. For example, research in successful case studies where hospitals or clinics have effectively integrated cultural competence in training could be offered below insight into this challenge and best practices for overcoming language barriers, bias, and system obstacles. Another area that intrigues me is impacting organization policies of the delivery of control sensitive care. While Tucker and Thomas highlight the importance of organization support, I'm curious about how different healthcare institutions measure and monitor cultural competence over the time. Investigating of the relationship between policy change and staff training and patient satisfaction could help identify which interventions lead to sustainable and improvements in the care for migrant populations. Additionally, I would like to learn more about how cultural competence intersects with emerging digital health technologies and how this would increase use of the telemedicine and mobile health apps, understanding how these tools can be designed to adapt to be culturally sensitive and accessible to diverse population on critical areas for future research. And this is could be lead to Okay, for the last question, give a list of one specific example of an aspect or experience in your personal professional life and relate to the main topic. As my personal experience, honestly, I have had an other study or experience beyond the I already shared in the previous videos. However, something that really makes me reflect is about when we have interaction as a students or even medical practices with the type of patients they're from the common to lot backgrounds and remote communities. And many of these patients are actually internal migrants with the country coming from the states like Guerrero, Oaxaca, or the south of the country and who relocate and in such places like Manelero or other communities that are be so far away from Ensenada. Often they not only speak a little Spanish, but sometimes can be only speak their native dialect. That's making communicating with us extremely challenging, and it can be difficult to explain to them what is affecting their health and how cope certain habits or practices they continue to do follow may further impact their well-being. I think as a healthcare providers, it's crucial to develop greater empathy, solidarity, and kind, and to put in twice the effort when we're working with this type of patients, no matter how complicated it may be. Neither they nor aware the blame for the economic, social, political, or even linguistic inequalities. This exists in the country and especially in Latin America. So therefore, it's essential to approach them with the understanding and share with the clear explain what is happening to them and why it might be to happen and what factors could be contributing to their condition. And we must communicate their treatment plan in detailed yet compassionate manner, explaining how it should be administered for how long, and how, and in the way that respects their reasoning without understating or blaming their understanding. I think it's more important that the treatment with this type of patients. And something I want to share is I actually working in a project with school, and my assignment it's called emprendimiento. And this assignment we work with the initiatives to have another experience or another things to complete or innovate. The sectors of health we don't uh, cover enough, and one of this is this barrier with people don't have access to uh, healthy services with with some value. And one of the ideas is get an app like a services we can everybody can use.